Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.
There's not really a injury that occurred, but I've had head trauma in the past that may have caused it. Just continuous discomfort.
Where do you feel the pain?
Up top of my forehead, the two joints.
The two joints, okay. So you said you had a history of trauma. Did you have concussion? Did you have falls? What did you have?
Yeah, I've had 5 diagnosed concussions.
Okay. And where did you hit your head?
The first 2 were in the back of my head.
Okay.
And then the last 3 were side.
Which side?
I think both sides, actually.
Okay, so those are actually a risk factor for TMJ issue. Okay, so that's happened. And how long you been having the headache and the jaw issue?
About 4 years now.
4 years. Okay. For the last 4 years, what kind of treatment you had for this?
No treatment.
You did not have physical therapy, chiropractor, or massage?
I started physical therapy a little bit this past year.
Okay.
It hasn't helped.
All right. Do you wear any night guard or anything?
Yeah, I have a night guard that I've been wearing for 1.5 years now.
Okay. So how much you rate your tightness or pain or headache from 0 to 10? 10 is emergency room, 0 is nothing.
Tightness, probably an 8.
Okay.
Headache, 5 or 6.
Okay. And how often do you feel that? Do you feel it's constant or comes and goes?
Every day.
Every day. So there's nothing like literally flared up because you're constantly feeling that.
It's the constant feeling.
So how you describe your headache? Like, where do you feel it? Do you feel nauseous? Do you feel like vomit, or you feel like sensitivity?
Headaches in the front of my head.
Okay.
I'll go through cycles where I do vomit. Yeah, just temples.
The temples.
And the front.
And do you feel like light sensitivity or noise sensitivity?
Noise sensitivity.
Okay, do you have the symptoms now, or just the headache, the pressure?
Just the pressure.
Okay, do you feel it behind your eyes too? Or just the front or here?
Just the front of my head.
Okay. Anything going on in your neck? Any pain or tightness?
Neck tightness. No, not really any pain.
Okay. So is your jaw is worse or your neck?
My jaw.
Or both? Okay. So do you have any clicking, grinding, like limitation in range of motion in your jaw, or it's okay?
Mostly just the clicking. I don't think I really grind that much.
Okay. Do you feel you're limited in your range of motion in your jaw?
I think my range of motion is
fine.
Okay, yeah.
Okay. So let's set up a nice and tall. I want you to open your jaw and close, and how much tightness you feel with that. Okay. How often it's click like this?
Every other time.
Does it click in one side or both? Alternate.
Alternates.
Okay. So every time you open it, it click like this?
Yeah.
Let's do it one more time. Okay. Let me see your range of motion for your neck. You're going to turn left and right. How's that? And back. And forward. How does that feel?
This definitely goes back further. On this side, it feels clogged.
Okay. Where do you feel it on the side?
I can't.
You cannot go
It's
further.
like stop, you know.
And side bend left and right. Side bend here is okay. It's a little bit tight on the other side.
Yeah.
Okay. All right. So everything pain-free. Is that painful? It's okay.
Yeah, you're fine.
Okay. Is your pain more in certain time or just a constant?
It's just constant. Just want to increase blood flow, right?
No. And what I'm working on now is the fascia. Okay, so we have a system called fascia, the super layer wrapping the entire body, very thin layer that's wrapping this the entire body. This is superficial fascia. It's like a Spider-Man suit. So when you have fascia restriction, it's like you're wearing a t-shirt 2 to 3 size too small, and that's what I'm trying to release, because when it's tight, it's actually compressing here.
Like,
so
definitely
this is normal fascia movement. You feel the mobility here? Okay, compared to this, that's not moving, so that's basically compression there. So what I'm doing is not increasing the blood flow, it's releasing, because anything can increase the blood flow. Massage can increase the blood flow. That doesn't mean it's healing. That doesn't mean it's treating the issue. So what I'm doing is actually releasing that fascia restriction, that compressing there. You feel the tightness here?
Yeah.
Okay, so
but I can also feel like it's been released a little bit.
Yeah, you will feel it.
I definitely feel a difference.
You will feel increased blood flow. You will feel warmness, because when your fascia is tight, it's like compressing on everything else. Yeah. So yeah, definitely will decrease blood flow. But it's the tightness decreasing the blood flow. So when it's released, everything is loose, so everything flowing, flying. Are you okay with that, or it's okay?
It's fine.
Okay.
I think it's like
sure. You feel the tightness there?
Yeah.
Okay. That's really tight. So I'm actually, and you will notice when I release that, it can have more mobility. Okay. And you said you have sinus infection?
Yeah.
Okay. Okay. In here, do you still feel tightness there?
Where it pops differently than this side. It's more of a harder.
I feel a lot of scar tissue. Both sides, but more scar tissue here. Fascia, more fascia restriction.
Yeah, this one, it feels like a buildup of, I don't know.
Let me show you. You can close your eyes or just relax. You feel that? You feel that bump here?
Yeah.
That's a scar tissue here. Okay, if you don't have a scar tissue, let me show you here. Feel how nice and smooth here?
Yeah.
There's nothing compared to this.
Oh,
do you feel that? That's a lot of scar tissue here. Here, you feel this? It's like a grain here, and here like a knot, like a piece of rock. Feel that? And I will not be surprised if you have more on the other side. Sorry. Make sure it's not painful.
Nah, it just feels weird.
It's weird. And here I can see the tools is like
yeah,
going like up and down. This feel. How's it feel?
It's fine. I mean, it feels terrible, but there's no pain.
Yeah, it's not pain. It feels terrible.
It just, I can hear
the scar tissue.
Yeah.
It's a bad. It's not painful, isn't it?
No.
It's just terrible to hear the sound of the scar tissue. You know, the scar tissue is talking.
Yeah.
That's very typical. With this tool, it's the design and the material help actually to hear the scar tissue, so it will be able to detect it. Because here,
it's crazy.
Nothing. There's nothing, and you start to hear the crunching. That's a good feedback about the size of the scar tissue, and hear more. In this area, feel this?
Yeah.
Like not here. I'm not surprised with all your history of trauma that you'll have all that scar tissue. So anytime you had injury, your body, you had a micro tear in that area. So your body started to build a scar tissue. But over time, you have several trauma. And instead of you have one layer of scar tissue, you have 50 layers of scar tissue. So you start to feel like a big knot. And when that happens, because our muscle should act like a rubber band when you contract and relax, scar tissues feel like a knot in the rubber band. So when your muscle contracts, it does not stretch much. And that's what shifts your jaw, so you start to have more clicking.
I mean, the shift to my jaw is not bad.
Well, think about your car out of alignment. You're gonna wear your tires more on one side.
It's out of alignment right now.
Well, that clicking,
it's
especially you have slight deviation. That's mean your muscles not contracting evenly, and you have a little bit tilt. So the goal is actually to keep everything symmetrical as possible. If you still feel the sound, that's not my concern now. Over time, we're gonna release everything. The sound should be decreased. Yeah. My concern now is your constant tightness and symptoms, that we need to break this vicious cycle and then clean up everything else after that.
I mean, my head definitely feels lighter. I feel like it's getting a little jammed up on this right side.
Mm-hmm.
I don't know.
What about the other side?
I feel like it feels like it's functioning normally on this side, mm-hmm. but it doesn't feel like it's...
Okay. So, do you have seizure or pacemaker or anything like that?
Yeah.
Okay. So, I worked on a proliferation now, and I'm gonna start working on inflammation, because it seemed that you have a little bit inflammation there. Okay. I'm really doing it on the joint itself because you have that clicking. Very interesting to see. So this magnet, I designed it with the anti-inflammatory coating on it. And it's a very strong magnet that should penetrate around 2 inches to 2.5 inches when I use one magnet. When I use both of them, the range very. Tightness.
About the same. Mm-hmm. Opening though.
Mm-hmm.
Right under here more.
Mm-hmm.
I think on both sides, but more.
Just localize. It's not all over like what you were.
Yeah, it's definitely not.
Okay.
All together.
All together. So it starts to shrink.
It's like separate in different spots now.
Okay, that's a good sign.
That makes sense.
That's a good sign. That's mean.
It's not like a whole bundle anymore.
That's a good sign. So yeah, we definitely need to work on it a little bit more. So, okay, all right, Alex. So today, can you tell me how do you feel? How many visits you had so far, and just a progress about your headache and jaw pain and neck pain?
So it's been 4 visits now,
mm-hmm.
and I think the first 2 visits
mm-hmm.
I wasn't really taking
mm-hmm.
the exercises and all the other advice, mm-hmm. following the program mm-hmm. seriously, but
mm-hmm.
I began to take that seriously,
mm-hmm.
and I've seen a lot of improvement.
Mm-hmm.
A lot of inflammation has gone down.
How much pain do you feel now? Do you have any symptoms? Are you back to normal? Just a progress about how you're doing. If we say like 100% back to normal, how far?
Probably at 80 to 85%.
85%. That's not bad.
Which is
mm-hmm.
really good
mm-hmm.
for me, because I think I was at
mm-hmm.
10%. I was just feeling
mm-hmm.
pretty bad.
Yeah, and it was affecting a lot of your function, yeah.
Yeah, definitely.
Mm-hmm.
It was affecting my daily
mm-hmm.
activities, function,
mm-hmm.
mentality.
How long has this been going on before you come?
3 to 4 years.
3 to 4 years, yes. And what treatment you had before?
I've had just regular TMJ physical therapy, mm-hmm. which did not work at all.
Mm-hmm.
What's that?
Did you have chiropractor massage?
I've had a chiropractor.
Mm-hmm.
Yeah, chiropractor and
mm-hmm.
physical therapy.
Yeah. Mm-hmm. So what do you think about the ASTR treatment? You had all of that, and you had that issue for 3-4 years. So what's your thought about the ASTR treatment after like 4 visits?
I think it's amazing. It's
mm-hmm.
something way different.
Mm-hmm.
Something that you wouldn't expect
mm-hmm.
that actually works.
Mm-hmm.
it's so simple at the same time.
That's good. Well, as long as it works. Yeah, awesome. Yeah, thank you so much.
Yeah.
Thank you. You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.